Courtney Weatherson. I'm from Salina Technical Area College in the dental assisting program, and we're here today to interview you, just go over a few questions. And we're here at Hayden Orthodontics. And what is your name?
Randy.
Okay, nice to meet you.
Me too.
All right, so how long have you been here?
2.5 years.
Okay, and do you like it so far?
Yep.
Okay. And what factors contributed to your choice to becoming an ortho assistant rather than a dental assistant?
In orthodontics, you get to do things that you can't do in general dentistry. I help put braces on, I help take them off, I put wires in and out, limited assisting with the doctor. I do lab work, impressions, we make appliances here in the office, just things, huge variety of things you can do so you can't get bored.
Okay. So I guess that kind of goes into my next question. I was just going to ask, what are some of the most common duties that you do as an ortho assistant?
Yeah, just taking in and out wires, and we do all Invisalign by ourselves. No doctor time, really.
And what would be the procedure that you assist most in?
Bonding braces.
Okay. Can you share with us what your most favorite and least favorite duties are?
Most favorite's the lab work, because I make these models that's a custom replica of someone's bite, the way they're biting. And my least favorite.
It's tough to think about.
It is hard. Probably when Dr. Hayden has to do IPR.
And what is that?
Interproximal reduction. It's when he takes like a metal strip and he files between a patient's teeth to allow tooth movement a little easier.
Okay.
It's rough.
Is that the use of diamond strips?
Mm-hmm.
I didn't know that. So what happens if the patient disagrees with the treatment plan you have presented to them, or if they don't have the proper funds?
That happens a lot. We're pretty flexible with people. We do lose people that cost is an issue, and that we do payment plans in the office. People typically disagree with treatment, especially if it comes to they have to take teeth out or they need surgery. And Dr. Hayden, he just presents like maybe 2 or 3 options, like this is the result you're going to get if you don't do it. This is the result you're going to get if you do. Whether they're happy with it or not, that's what we do.
That's good. Can you share with us what your interpretation of being successful in the dental industry means to you?
What do you mean by that?
I guess just what would success, like becoming a successful dental assistant?
Learning to get along with the girls, which isn't always easy, but here it is, but I've heard it's difficult. Having a relationship with the doctor, because typically, not with my job, but with the typical assistant, you are with that doctor all the time, and you have to be 2 steps ahead of him. You have to know what he's doing and why he's doing it, so it's not easy here, but...
Okay. And is there any way that you guys promote the business, or is there any way to get your name out in the community, like K-Mom, I know is a big one?
Yeah, we don't do that. There's a Purple Power Play here in Manhattan. A coworker has a big purple bus, and we have a big booth there. We don't do a lot of advertising, just because we don't really feel like we need to. Business is good mainly through word of mouth and referral by a dentist. So, I mean, we're pretty booked out, so.
That's good. Can you describe the work relationship between the orthodontists? I know you kind of said that you just have to be really close and stay 1 step ahead. Is there anything else maybe with that?
I can't think of anything.
Okay.
Dr. Hayden's pretty easy going.
What can be expected for an orthodontist in the future? or like for an assistant going into ortho maybe? Is there anything to explain?
When I first started, I was told many times, you are going to learn so much at once, you're not going to understand a single thing anybody's telling you for the first 3 months. Like Dr. Hayden has a phrase, is it clear as mud? It's clear as mud. That's their first 3 months. Like so much information all at once, and then slowly, eventually, it all begins to click.
That's good to know. When people hear the word orthodontics, they automatically think of braces. Can you share with us maybe any other procedures besides braces?
Yeah, we do a lot that's not just braces. We do, people have TMJ, we do splints for that. Those are very successful. I use one myself and I love it.
Oh, really?
Yes,
That's
they're
cool.
very bad TMJ. And we do gingivectomy, frenectomies. Gosh, we're getting into, Dr. Hayden's looking at Botox. It's just, it's for TMJ. It's just, you wouldn't have thought. Sleep study, this dental appliance you can get. We're going to be kicking that off here soon. Dr. Hayden's done plans before. It's just, it's full teeth. You never know what we're going to do next.
That's cool. In your opinion, what makes a specialty practice better than working in a regular dentist office?
That depends on the specialty. A lot of specialties, they just do one thing. So that would drive a person like me crazy. Some people like it. I can't imagine doing that. So a lot of people just really migrate towards the specialties because of the pay. But that depends too. So I don't know. Some people can't, if you're a dental assistant and you love it, you can't handle ortho. And if you're working with a periodontist, you can't handle, general or something. It just depends.
What would you tell an aspiring student that plans in the dental program? Do you have any inspiring words maybe for them?
I'm not very good at inspiring words. The only thing I can say, I don't know how inspiring it is. It's fairly easy to get a job. Once someone's hiring, it seems like you get like obscene amount of job offers. I know I was really stressed out about that. Weigh your options and make sure that, there's some offices that you just do not want to work at. So if you know anybody that lives in the town, typically most dental assistants, because it's such a close-knit community, know what's going on in the next office. So it's like, they're always hiring, there is a reason why. Just keep an eye on that when you're looking for a job.
Okay. Do you have any other questions? Okay. Kind of answered all of them. All right. Well, I appreciate your time.
Yeah.
Thank you for meeting with us.
You're very welcome.